Hello and welcome to the Neurology Video Journal Club. Today we're reviewing an article published this year in Neurology entitled Sex Differences in Clinical Features, Treatment, and Lifestyle Factors in Patients with Cluster Headache. The first author is Dr. Carmen Fourier, and the senior author is Dr. Emmanuelle, both at the Karolinska University Hospital in Sweden. So for some introductions, my name is Mark Burish. I'm an associate professor at UTHealth Houston, and I do some clinical and some basic science research on cluster headache. And I'll be hosting this episode along with Dr. Emmanuelle Schindler. Emmanuelle, how are you?
I'm doing well. Thank you, Mark. I'm Emmanuelle Schindler. I'm the medical director of the Headache Center of Excellence at the West Haven VA Hospital in West Haven, Connecticut. And I've been doing clinical research in cluster headache for some time. And it's one of my favorite headache disorders.
So Emmanuelle and I are both MD, PhD cluster headache researchers, I'd say in about the same stage of our career. We recently published a clinical review together, although it's not published in an American Academy of Neurology sanctioned journal, so I suppose we shouldn't talk about it too much. But Emmanuelle, yeah, I always enjoy talking cluster headache with you, so I'm looking forward to talking about this article. So to start, Emmanuelle, can you kind of define what cluster headache is?
Sure. Cluster headache is a neurological disorder that's characterized by attacks of head pain that are characteristically on one side, usually around the eye, and that are accompanied by autonomic symptoms like tearing from that eye or drooping of the lid on that side or nasal congestion. Cluster attacks are very severe in terms of their pain intensity. It compels patients to move around. Laying still makes them feel worse, so they'll pace, they'll rock in place to help alleviate pain. Even though cluster attacks are relatively short, they're only about an hour long on average, they can happen multiple times a day, and they tend to happen overnight. So cluster headache patients don't get good sleep. And they have a peculiar circadian pattern. Again, overnight's most common, but other patients may have them at other times of day. This makes the condition very interesting from that standpoint. And most patients also tend to have the attacks the same time every year. Again, sort of speaking to the circannual pattern to these attacks.
It's just a terrible condition in the sense of how painful it is when it strikes and kind of all these very curious features to it. And there are two reasons I think that we needed this study. Cluster headache is more common in men. So it's one of the few primary headache disorders that is more common in men. Migraine is famously more common in women. So this male predominance has always been kind of an oddity. And oddities, I think, for scientists are worth studying from a research perspective. When you study an oddity, you might find something new that can advance science. But the differences between men and women just aren't clear. But we used to think cluster headache was 6 times more common in men. Now it's more like 2 or 3 times more common in men. So if the sex ratio keeps changing, that means you may not be capturing enough of one sex. So it's hard to be confident in any of the differences between men and women. So both because it's an oddity and because of the previous data that's been changing, we need a well-designed study. Emmanuelle, any other background information you think is important?
Yeah, I think it's noticeable that as you look in the literature, the ratio has been changing over time. It's not too surprising because I have plenty of female cluster headache patients, and I know they're out there. So I think having a study where we can really quantify the ratios and understand differences is really important.
Yeah, it's funny to think of. There's lots of reasons that it could have been changing over time. Sometimes people assume that if you're female, you must have migraine. If you're male, you must have cluster headache, and people get misdiagnosed fairly often, I think. But for whatever reason, it's been kind of coming down over the years. So for this study, again, they obviously looked at a lot of males and females, but here was the study design. So they asked 46 questions on paper. They mailed this to lots of people in Sweden. And patients were identified by a record review. So they took all the ICD-10 cluster headache diagnoses from all the major Swedish hospitals and all the major neurology clinics, and then just read the charts in detail to see if they met criteria. For those of you who are trainees, ICD-10 codes are these international codes for different diagnoses. Anything from heart disease, every little heart disease, to every little bone fracture, to every type of headache. And so patients will assign a diagnosis code when the patient comes in for a visit, so they can go to the medical records and just search for those diagnoses. So once they reviewed all those charts, they ended up getting about 900 patients who ended up taking the questionnaire. And these patients were actually also part of a biobank. So they actually genotyped everybody and confirmed the sex, and actually found that all the sexes matched all the genotypes. So just another amazing level of detail for this study. So Emmanuelle, any thoughts on the study design?
That's great how much detail they went into, how much work they put in, not only to verify the sex, but the diagnosis as well. As we just talked about, the potential for missing people with the diagnosis. It may go the other way, where people might get a diagnosis of cluster for coming in one day with a bad headache on one side, but it may not actually be cluster. So I think that they're going into detail and really verifying the diagnosis was really good.
Yeah, I think the amazing thing, Emmanuelle, you and I have both done epidemiology studies and looked at large groups of patients, but they calculated that if you looked at the number of working Swedish people with cluster headache, they got about 25% of everybody in Sweden. I mean, that's just from a epidemiology perspective, that is amazing. I just don't think you get a lot of studies where you can capture that many people.
That is pretty impressive, yeah.
So here were some of their results. They found for the sex ratio that it was about 2 to 1, which is consistent with a lot of the more recent studies that, as far as cluster headache goes. And so it's a lot more common in females than we used to think. The other things they found when they compared details between males and females, and if you look at all these, the red obviously are the more significant things, but these are family history, comorbid migraine, these are kind of epidemiologic things. These are more common in women. Not shown here were a couple of findings which were not significantly different, like age of onset and smoking. Smoking is famously more common in cluster headache patients than the general population. For this study, alcohol is actually less common, or alcohol use less common in cluster headache, primarily because it's a big trigger for patients. But in the middle here are disease features. So ptosis, the eye drooping, and restlessness, and chronic cluster headache are all more common in women. And what Emmanuelle talked about before, that clock-like or circadian timing to the headaches, those are also more common in women. Alcohol is a trigger, a little bit more common in men. Again, not shown here. There are a couple other findings which are not different. Pain intensity was similar between both groups, and they did a 1 to 10 scale. It was 9.4. Like Emmanuelle said, it's incredibly painful headache. They've done lots of studies about how painful this is. The 9.4 out of 10 is not something that's very surprising to most headache specialists. And cluster headache is just a severe level of pain. And then on the right side are treatment features. Both cluster headache, both male and female, over 90% use some sort of acute treatment to break their headaches. But more females are actually using preventive medications. Emmanuelle, any thoughts on the results for this paper?
Yeah, I just leading off of the last point that you mentioned about the use of the preventive medications. Can you remind me, did they list what preventives they were on? Because if more women also had migraine, might they have been on something for migraine? That makes me wonder. And also because women maybe at some point in the past may have been misdiagnosed, might have been placed on a migraine medication. So I wonder if there was a list of different types of treatments.
Yeah, they went into, sorry, I don't have a slide on this. They went into it a little bit and found it was not significantly different for any particular medication. They looked at verapamil, prednisolone, Tizodafin, which I believe is not available in the US, lithium, topiramate, and then other. But there was no significant difference between males and females for any of those. On the acute side, females were a little bit more likely to get oxygen, but the other things, triptans, codeine, ergotamine, all those were pretty similar. So you're right. I would have expected them to be taking things like topiramate or something a little bit more commonly in women, just getting lucky that they were treating it for migraine because they are more common to or more likely to also have migraine, and it happened to treat both.
Yeah, and I don't expect either of us to maybe know this offhand, but are the monoclonal antibodies available in Sweden? Because those as well, or perhaps a survey was started before they were available.
Yeah, it's a good question, and I know the dose for the galcanezumab is higher in cluster headache, but there have been, I think, lots of us that have tried lower doses or tried other CGRP monoclonals for cluster headache just to see if they'd be helpful. And theoretically, maybe they're slightly less effective, but they're still effective. But I don't know about the approval in Sweden. But you're right. There's a few medications that kind of cross between migraine and cluster headache, and we do that all the time in neurology, where we try to find one drug that'll treat two things to keep things, reduce side effects and things like that. So yeah, it's a good thought. And I don't know, Emmanuelle, you may know, if people have tried, in patients who have both cluster headache and migraine, does topiramate work better? Does it not work as well? Does it? Yeah, I don't know the answer to that.
I have anecdotally heard patients who have both migraine and cluster will say that when that the headache disorders will kind of feed off each other, so that when their migraine burden is worse, their cluster burden is worse. So I guess you could indirectly treat cluster by handling migraine if the conditions are comorbid. So yeah, it's interesting. I'd want to dive deeper and kind of get at some of those questions, but it's interesting that that there's a difference there.
Yeah, have you ever had? I've had a couple of patients that have given me stories that I used to have migraines, and then when I started getting cluster headaches, the migraines went away, or something like that, where these patients have comorbid migraine, but they don't have it anymore. Like it's almost the opposite of some of your patients, where they don't feed off each other; they like cancel each other out. I don't know if you've ever had those patients.
I don't think I've had one of those. I more so have ones that have both and that feed off each other. Yeah.
But yeah, and so going back to the figure here, if you look at women versus men, um, if you take some of these significant things that differ between men and women, you know, the disease is simply worse in women than it is in men. It may be less common, but it's worse. I don't mean worse in terms of disability. I mean more ptosis, more restlessness, more chronic cluster headache, more use of preventives. It's a fascinating finding. Why is this less common but more burdensome in females compared to males? I don't. The family history is kind of interesting. Maybe there's a stronger genetic component that we can talk about. But Emmanuelle, from your perspective, this data I think is interesting from a scientific part of things, but for neurologists, how do you think this study can help neurologists now?
I think that learning about cluster headache is really important for neurologists, because it's often one of the first places where they make it diagnosed at a general neurologist's office, or deciding, is it migraine, is it cluster? Oh, they're a woman, they can't have cluster. I think that this clearly shows that you have to keep cluster on the radar for women as well as men. And to not forget to ask about these features that are characteristic about of the attacks. The more having chronic cluster headache being more common in females too, that's really interesting. But I can also see that being something that might hinder a correct diagnosis, because when someone has episodic cluster headache and they go into cycle every year, the same time of year, that really sets off bells for cluster. But with chronic cluster headache, I can see that being mixed more with like, oh, maybe it's just migraine. So I think that that's an important point to recognize too, and a good learning point for neurologists.
Yeah, I think that's the biggest takeaway point from this, which is if you have females and they have year-round headaches, it may still be cluster headache. And the reason that's important for the diagnosis is while there are some medications that overlap, most don't. Unless you're giving the patient triptans and topiramate, the other medications, oxygen is going to work for cluster headache, but probably not for migraine. Lithium, same, is going to work for cluster headache, but probably not for. So misdiagnosis, unless you get lucky with a couple of the drugs, you'll probably be mismanaging that patient, and you'll keep trying medicines, and they won't work until eventually you have to figure out the right diagnosis. I think from a scientific standpoint, there's been a lot of genetic research in cluster headache recently. So there's 2 genome-wide association studies from Europe, one from Taiwan in the last couple of years. They all seem to agree on a similar set of genes, not very many, but they all were susceptibility genes for cluster headache. So Emmanuelle, any thoughts about how the sex data might relate to the genetics?
Well, I wonder, given that this at this study also asked about migraine as well, is there any overlap with those genes, with the cluster genes, migraine genes, or other headache disorders as well? I wonder if there's overlap there. Having a stronger family history or that's also relevant to me as well, because I wonder, and offhand, I don't recall, were any of the genes sex linked, the ones that were identified?
I don't think so. I
Mm.
think they were all, yeah. No, I don't think that any were sex linked.
But they may be influenced by hormones. So that's a whole area that should be explored more. Yeah.
Yeah, I agree. I think, migraine, very common to run in families. Cluster headache seems to be, some rate, not as much as migraine, but it runs in families. And, is there an overlap between migraine and cluster headache genes? There's not a lot from these GWAS studies. There was one, the genome-wide association studies. There was one study in Sweden specifically, and this is a Swedish study, that did find a particular gene in their population. The Swedish group has been very good at looking at a lot of different genetics because, again, they have this huge biobank of patients. But I think one gene that connects the two probably doesn't explain all of the genetic, the family history between these two. And I started the podcast today of talking about oddities worth being studied, and I think, Emmanuelle, what you were talking about there with hormones is kind of one of those interesting things that's probably worth studying further. I mean, it's the idea of, is estrogen causing migraines or more likely to trigger migraine, but less likely to trigger cluster headache? Is estrogen, if you get cluster headache, does it make the burden of disease worse? We know that in cluster headache, in rare cases, you can get pituitary hormones that have prolactinoma or some sort of pituitary expressing tumor that causes headaches look exactly like cluster headache. You treat that disease, you treat the hormone irregularity, and the headaches get better. So I think for the oddities, I think that looking at estrogen, looking at some of these hypothalamic pituitary axis types of things would be really interesting. I don't know, Emmanuelle, if you have thoughts on that.
Yes, I've been nodding my head along because yes, I do think it's that would be uh a place that could help tie together the the age of onset, the circadian function, even. And I also there are some patients, I don't know if they necessarily have to have low testosterone, but there are also reports of patients being treated with testosterone with dramatic relief or even remission possibly of their cluster headaches. So and again, what you had just mentioned, is estrogen more geared to migraine and testosterone geared more towards cluster? And maybe is that why the male predominance, even if it's not as much as we thought, that can certainly be looked at. It's unfortunate that we don't really have a good animal models for cluster headache, because that would that would allow us to also look at different, if we had good models, we could do some more basic science work in that area too.
Yeah, you look at studies like this and you immediately start to think of that kind of bed to bench side type of thing. Like how would we then go back and but the limitations on the bench side of things with the models, we have models of single parts of cluster headache where you look at just the autonomic part or just the pain part, but nothing that kind of seems to link them all together. But so right now it may be looking a little bit more at these types of studies or looking at human patients or humans just to see if we can find some sort of changes in that system. I do think it's interesting from the human side of things that if you think that it's estrogen that might be related, you think, well, then it should be just in menstruating women. So if you're young, pre-puberty, post-puberty, that you shouldn't have that same rate of cluster headache or migraine. And that's exactly what we see, I think, in some of the epidemiology data. It's pretty similar between men and women, both for migraine and cluster headache before you hit puberty. It's pretty similar after menopause. It's just in that middle part that there's a big difference both for migraine and for cluster headache. So there is some human data there. It's just, where do we go further with that? So I think to conclude on this, it was a very strong study in the sense of a very definitive examination of women in cluster headache, a very large data set that was looking at a question that we really hadn't kind of finalized, that we hadn't really come down to an exact answer just because there were so many different studies saying so many different things. The strength of this study, it had a huge data set, over 800 patients. All of them had been diagnosed with cluster headache by headache specialists, either reviewing the records or making the diagnosis themselves. Everybody had been genotyped. They asked them this very kind of nice, concise survey that was mailed out to everyone, just very well done study. And I think this really helps move the field forward. Emmanuelle, any final thoughts about the study?
Yeah, I think that we need more studies like this. This was a really well done study. This sort of, as is the point of research, it actually generates more questions that we can then go after. So I hope that this also encourages others to maybe take an interest in cluster headache. Really fascinating disorder. And the patients, cluster headache patients, are very eager to take part in research as well. So I hope that those who are interested in doing research recognize that they have a patient pool who really want to learn about their disorder and help others. Yeah.
Yeah, and obviously I agree with that. The cluster headache patients are amazingly kind of generous with their time, with their effort, with things that they're kind of willing to help out with. And so it's been a fun area to research, both from the oddities of it, the scientific part of it, and from the patient group themselves. So Emmanuelle, as always, great talking with you about cluster headache. And for all the viewers, thank you for listening to this episode of the Neurology Video Journal Club, and have a nice day.